personally, it was just being able to provide a service for families in need. Like, I've personally experienced instances with like elderly grandparents or family members who require a certain service and we're not able to provide it firsthand for them. The transfer teams themselves, like I mentioned, I've dealt with them personally on a personal level, are always very accommodating and very calm, and they always approach it a certain way, which makes you relaxed and at ease, having the team members take over and get them there as safe as possible.
We're a hospital here in town, and I was picking up this mother, and she was, not doing well, and so the torch came around. I grabbed my phone and I took a photo, and I sent it. Once I met with the family, I said, hey, your mom and I were able to meet the mascot, and we held a torch. I took a photo for you. Not, they didn't ask me to do it, but I figured it was something that they would like, because who doesn't like to take pictures with the torch and anything involved with the Olympics? And they were ecstatic about it, and they provided me with their email, and I sent it out to them. Just doing little things like that, It's not even a part of the service, but it's just something that I knew would kind of warm the family's heart to have that to cherish it for the future. Mm-hmm.
So for just a few months, she was terrified. This was her first baby, and I feel teary kind of feeling, listening or remembering the story again. She was just crying pretty much the entire transfer, to bring her to the hospital to be with the baby boy, and trying to relay to her that it was going to, everything was going to be okay. She was going to be in good hands there, and I myself had my baby at that hospital, and just trying to understand like how terrifying it had to be for her. Like, could you imagine being in a country, your first child, your child being ill, and not knowing what's going on, and not knowing if you can trust the people around you? Like, it's terrifying. So remembering those things.
Talk in whatever language that someone says that they're speaking. It's so small and it doesn't work all the time, but it's like really the best you can do in a situation like that.
And we're all human too. Like at the end, we do have situations like that. And after the call, sometimes we actually have to take a few minutes to ourselves to try and regain our composure and let it sink in. And yeah, sometimes a couple tears will fall in that, but we wipe them off, and we think of how thankful we are to have the healthcare that we do have in this country.
Pediatric calls that I did a transfer on. It was a 3-year-old little girl that we took back to her home hospital, and she gave me the biggest hug when we dropped her off at the home hospital, and she said, "Thank you so much for getting me home." So
This is the best place for care for both of them in the entire world, and would offer that.
My name is Sam, and I care.
My name is Jessica, and I care.
My name is Shelley, and I care.
We care.